Don't ignore these 10 early signs of diabetes. They could save your life. Some of these symptoms might catch you off guard, but spotting them early can help you stay ahead of serious health problems. Stick with us until the end. Understanding these warning signs could truly make all the difference. Number 1. Frequent urination and constant thirst. We've all had those nights where we wake up to use the bathroom or grab a drink of water, but if this starts happening often, it could be a subtle clue that something's off with your blood sugar. High blood sugar levels force your kidneys into overdrive, trying to flush out the extra glucose. This leads to frequent urination, a condition called polyuria. As your body gets rid of the excess sugar, it also loses a lot of water, leaving you dehydrated and constantly thirsty. This endless loop of drinking and bathroom trips can disrupt your sleep and leave you exhausted during the day. If you're feeling more thirsty than usual or visiting the bathroom more often, think of it as your body waving a red flag. Start by checking your blood sugar regularly, especially before bed, and speak with your healthcare provider if something seems off. It's also smart to stay hydrated throughout the day, but avoid drinking too much water right before sleeping. Small steps like cutting back on sugary drinks and eating fiber-rich, balanced meals can help keep your blood sugar steady. For older adults managing diabetes, paying attention to thirst and bathroom patterns is especially important. If ignored, these signs can lead to problems like dehydration, fatigue, and even kidney strain. The good news? Being aware of these early shifts puts you back in control. By making simple lifestyle or diet changes, you can sleep better, feel better, and stay ahead of diabetes-related issues. Number 2. Skin changes you shouldn't ignore. Have you ever seen dark, velvety patches of skin around your neck, armpits, or even your groin? They might seem harmless, but these patches, called acanthosis nigricans, can actually signal insulin resistance. Normally, insulin helps move sugar from your bloodstream into your cells, but when your body stops responding to insulin properly, insulin levels rise. That excess insulin causes skin cells to grow faster, especially in areas where skin folds or rubs together, like your neck and underarms. These dark patches that may look like dirt or pigmentation are actually your body's way of saying it's not handling sugar the way it should. If you notice this, don't ignore it. Instead, see it as a sign to step up and take control of your health. You can manage insulin resistance through a healthy diet, regular exercise, and tracking your blood sugar. These changes can prevent those patches from getting worse, and more importantly, stop prediabetes or type 2 diabetes from progressing. To keep both your skin and your health on track, start with simple, practical habits. Swap sugary snacks for whole foods like leafy greens, healthy fats, and lean protein. Add light exercise into your day, like a brisk walk or some gentle strength training. These changes aren't just about appearances. They're about how you feel and taking back control, one step at a time. 3. Skin tags could be more than just harmless growths. At first glance, skin tags might seem like tiny, harmless flaps of skin, but they could be a subtle warning sign of insulin resistance. These soft, flesh-colored growths often pop up in areas where skin folds together, like the neck, armpits, or groin. If you've suddenly noticed several skin tags appearing out of nowhere, it's time to take a closer look. When insulin levels are high, they can cause the skin to grow more quickly, which may lead to the formation of these tags. It's your body's quiet way of saying, something's not quite right. So what should you do? First, don't panic. Skin tags are usually harmless and very common, especially as we get older. But their presence might be a clue that your blood sugar isn't well managed. This is a good time to check in with your doctor and ask about testing for insulin resistance or prediabetes. Catching it early gives you a chance to make changes that could prevent more serious complications like type 2 diabetes. The upside? Managing your blood sugar doesn't have to be complicated. Focus on eating well-balanced meals with fiber, vegetables, healthy fats, and lean protein. Cutting down on processed foods and sugary drinks can make a big difference too. Add in just a little movement each day, like a short walk after dinner, and you'll be taking real steps toward better health. Sometimes, something as small as a skin tag can be the wake-up call your body needs. Number 4. Recurring infections that won't go away. Ever feel like you're constantly battling one infection after another, whether it's a stubborn urinary tract infection, UTI, a lingering yeast infection, or skin issues that just won't heal? This might be more than just bad luck. When blood sugar levels are too high, your body becomes an ideal environment for bacteria and fungi to grow. Excess sugar in the bloodstream, and even in your urine, acts like fuel for these organisms, helping them multiply and spread. On top of that, diabetes weakens the immune system, making it harder for your body to fight off these infections effectively. If you're noticing repeat infections, it's time to connect the dots. Frequent UTIs, yeast infections, or skin abscesses could all be warning signs that your blood sugar is out of control. And brushing them off isn't just uncomfortable. It could lead to more serious health problems down the road. Don't wait. Talk to your healthcare provider about your symptoms and consider getting tested for diabetes or insulin resistance. Taking action early can help you stop infections before they escalate and protect your overall health. The best defense? Keeping your blood sugar stable through simple, daily lifestyle choices. Cut back on processed foods and refined sugars. Add more nutrient-dense whole foods like vegetables, lean proteins, and healthy fats. Hydration matters too. Drinking enough water helps your body naturally flush out excess glucose. Even small habits, like going for a 20-minute walk each day or checking your blood sugar regularly, can boost your immune system and help you feel better. Your body has an incredible ability to heal. Just give it the support it needs. Number 5. Diabetic stiff hand syndrome. Have you ever tried pressing your palms together like you're about to pray, only to realize your fingers won't fully straighten or your palms can't touch? That's not just regular stiffness. It could be a condition called diabetic stiff hand syndrome, or diabetic cheroarthropathy. This condition develops when high blood sugar levels stick around for too long. Over time, excess sugar binds to the proteins in your skin and tendons in a process called glycosylation. That causes soft tissues to thicken and lose flexibility, which limits how much you can move your hands. In the early stages, it usually isn't painful, but if left untreated, it can become more restrictive, making it hard to grip objects, type, or do everyday tasks. Many people confuse this with arthritis, but the difference is important. This stiffness isn't caused by joint damage. If you're experiencing symptoms like the prayer sign, where your hands won't fully close or press flat, it's a good idea to get your blood sugar levels checked. Catching it early can help you avoid long-term complications. The most effective way to manage diabetic stiff hand syndrome is by keeping your blood sugar in a healthy range. You can do that with a mix of balanced eating, regular physical activity, and consistent monitoring. To maintain flexibility, try simple hand stretches, like opening and closing your fingers or pressing them against a table or flat surface. Remember, managing your blood sugar doesn't just protect your hands, it helps your whole body stay strong. Small, consistent actions today can lead to a more capable, healthier tomorrow. Number 6. Trigger finger and frozen shoulder. Sometimes, your body sends quiet signals that something isn't right, like a finger that feels stuck or a shoulder that won't move without pain. These issues, known as trigger finger and frozen shoulder, can be more than just random stiffness. In people with diabetes, high blood sugar can cause inflammation and thickening in the tendons and nearby tissues, making everyday movement more difficult. Over time, it can feel like your joints are locked, making simple tasks uncomfortable or even painful. With trigger finger, you might notice one or more fingers snapping or catching when you try to straighten them. There might even be a small, tender lump at the base of the affected finger. Frozen shoulder, on the other hand, can make it hard or painful to lift, rotate, or reach behind you. It can seriously impact daily activities like dressing or driving. Both of these conditions are surprisingly common in people with diabetes, but they often go unnoticed until the symptoms get worse. Here's the good news. Early action makes a big difference. Start with gentle stretches to help keep your joints moving, and focus on managing your blood sugar to reduce inflammation. If the stiffness continues, don't wait. Talk to your doctor about treatment options such as physical therapy or anti-inflammatory approaches. Catching and addressing these signs early can help you regain flexibility, ease the pain, and stay active with confidence. Number 7. Neuropathy and foot damage. One of the most commonly missed signs of diabetes starts with something small, like a tingling feeling or the strange sensation that you're walking on cotton. This is often the first sign of neuropathy, or nerve damage, caused by high blood sugar levels. Over time, the nerves, especially in your feet and hands, can become so damaged that you stop feeling pain, heat, or even injuries. While that numbness might not seem like a big deal at first, it can be dangerous. Cuts, blisters, or small wounds may go unnoticed, leading to ulcers or infections. But foot problems from diabetes don't end there. Poor circulation, another complication of diabetes, makes it harder for wounds to heal. If left untreated, these injuries can worsen, and, in the most serious cases, lead to severe infections or even amputations. It's a sobering thought, but the good news is it's preventable with daily care and proper blood sugar control. Protecting your feet starts with simple routines. Check them every day for cuts, swelling, or changes in color. Wear well-fitting, comfortable shoes that protect your feet from injury. Keep your blood sugar within a healthy range to protect your nerves and help your body heal properly. And if you notice persistent numbness, sores that won't heal, or changes in foot shape, don't wait. See your doctor right away. Taking care of your feet isn't just about staying comfortable. It's about protecting your independence and your overall health. Number 8. Severe infections and the risk of amputation. With diabetes, even a small cut or blister can become something serious. High blood sugar weakens your immune system and slows down blood flow, making it much harder for your body to heal, especially when it comes to your feet. Over time, wounds that aren't treated properly can turn into severe infections. These infections can spread to the bone or surrounding tissue, and if they continue to worsen, amputation may become the only way to stop them from spreading. That outcome is scary, but it doesn't happen all at once. It usually starts with small signs: redness, swelling, or a sore that just won't heal. The problem is that nerve damage, neuropathy, can make it hard to feel these injuries. So by the time they're noticed, the infection may already be advanced. That's why daily foot checks and consistent blood sugar control are critical for anyone living with diabetes. To stay ahead, inspect your feet every day. Look for cuts, bruises, swelling, or any changes in skin color. Don't ignore anything that seems off. Keep your blood sugar in a healthy range to support your immune system and promote better circulation. And if you notice a problem, even a small one, see your doctor immediately. Prompt care can make all the difference. Taking care of your feet now helps protect your ability to stay active, healthy, and in control of your future. Number 9. Gastroparesis, when your stomach slows down. Have you ever felt full for hours after eating just a small meal? Or struggled with constant bloating, nausea, or even vomiting? These could be signs of gastroparesis, a condition where your stomach empties much more slowly than it should. For people with diabetes, high blood sugar can damage the vagus nerve, which controls the muscles in your stomach. When this nerve doesn't work properly, digestion slows down, leading to unpredictable and uncomfortable symptoms. But the challenge doesn't stop there. Gastroparesis can also cause unstable blood sugar levels. One meal might linger in your stomach for hours, delaying a spike in blood sugar, while another might digest too quickly. This roller coaster effect can make diabetes management much more difficult and leave you feeling off balance. Managing gastroparesis starts with small, simple changes. Try eating smaller, more frequent meals instead of just 3 large ones. Focus on soft, easy-to-digest foods, chew thoroughly, and stay upright after eating to help your stomach process the meal more efficiently. Most importantly, work closely with your healthcare provider to fine-tune your blood sugar plan. While gastroparesis can be frustrating, the right strategies and awareness can make a big difference in both your comfort and your blood sugar control. Number 10. What's the next step? Now that you're aware of the early signs of diabetes, here's what to do next. It's simple but incredibly important. Get tested. The hemoglobin A1C test is considered the gold standard. It measures your average blood sugar over the past 2 to 3 months and can confirm whether you have diabetes or prediabetes. For many people, it's the wake-up call that sparks real change. If you've noticed symptoms like increased thirst, skin changes, or tingling sensations, now is the time to talk to your doctor about getting this test. An A1C level of 6.5% or higher confirms diabetes, but even slightly elevated numbers can indicate prediabetes, giving you a critical window to take action before things progress. Catching diabetes early means you can start with small, doable changes, like adjusting your meals, becoming more active, and creating healthier habits. These steps can protect your health for years to come. Remember, knowing is only half the battle. Don't put it off. Schedule that test and take charge of your health. Recognizing the signs is the beginning, but what truly makes the difference is what you do next. And before making any changes to your diet, exercise, or lifestyle, always check in with your healthcare provider to make sure the plan is right for you. Your health and safety are what matter most. By catching these early signs, you give yourself the power to stay in control and protect your future. Even small steps like eating better and staying active can lead to big results. Spotted a symptom? Don't ignore it. Like, follow, and save this video. It might help someone else catch diabetes early. Your health starts with awareness. Stay informed.